Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome to another edition of your favorite Medicare podcast, Medicare Moments, with your host, the one and only Toni King. Hi, Toni.
I am the one and only Toni King because there's nobody else in Medicare that's a T-O-N-I.
That's right.
That's right.
You are Toni King, and Toni helps you each and every week. There's a brand new podcast every Wednesday morning, and we'd like you to tell your friends about it and share it with everyone so that they can get all the latest news about Medicare. And we are coming up to an annual enrollment period.
One thing we need to let people know is what we do is we tell them exactly how Medicare is going to affect them. That's what people need to know. Not how your insurance company is going to do, not what insurance plan is best for you, whether you go with XYZ company or QRS company, but how Medicare is going to affect them. That's where we're different. We give them the truth, don't we, Jim?
That's based on all of your research, and I think that's why so many people every week come to the Medicare Moments podcast. So, Toni, we're going to go to Springfield, Missouri today for this question. It says, "Hello, Toni. Thank you for teaching us the value of finding the right Medicare option for my husband and me. When he retired at age 70 a few years ago, Clint was determined to go with a Medicare Advantage PPO plan because it had a $0 monthly premium and thought there was no difference between a Medicare Supplement and a PPO plan except the cost. Last week, Clint received a life-changing diagnosis of terminal lung cancer. Had he chosen the PPO Advantage route, then Clint and his medical team would not have been in control of his health care. Please let your readers know of our situation because healthcare needs can change in a flash like Clint's did. Thanks, Raquel from Springfield, Missouri." So you really helped them, Toni, and you really helped save them at a time when they weren't expecting something.
They came into my office in June, and by August is when he got his diagnosis. 3 months later, he'd never been sick in his life. And poof, there you go. Things had changed, and had he chosen the Advantage plan, he would be at the mercy of the insurance company, telling him when and where and how he can go to the doctor. He chose original Medicare with a Medicare Supplement, and him and his doctors were in control of their health care. So that's what people need to understand, how Part B is like gold.
Toni, let me ask you, because you do this all the time, and everyone thinks about the dollars, how much is it going to cost me? So do you get pushback when you say to someone, well, yeah, you can go to this plan for $0, but you're missing this, and this potentially? I mean, how do you handle that?
How do I handle that? They tell me that they've never been sick. I said, that's right. You've probably never had an issue, but Christopher Reeve did not plan on falling off a horse and changing his life. It happened so fast. We can always go to a Medicare Advantage plan. That's what this annual enrollment period is all about. From October 15th through December 7th is when you can enroll in a Medicare Advantage plan without having to answer one health question. There are no health questions. But with a Medicare Supplement that works with original Medicare, after 6 months, you do have to answer health questions. And if now you've got a health issue, you're in big trouble. You just got to take your time. Don't get sold something over the phone, or don't get sold something because you see something on TV. Right now is when there's major advertising going on. All the call centers are coming from overseas. Their idea is they just have to get someone to say yes so somebody else can call them. It's just a cycle. Be careful. Your health is very important. You know that, Jim. We've been working together as I met you. You became a client. Now look, what's going on?
That's true. Which Medicare option is right for you is the topic of today's Medicare Moments with your host, Toni King. You can also call Toni any time of the day or night. She'll get back to you. 832-519-8664 is the number. 832-519-8664. Don't go away. We'll be back with more right after this.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Medicare Moments with your host, Toni King. Which Medicare option is right for you? I'm Jim Glogowski, joining Toni today, as we do every week, for a brand new Medicare Moments every Wednesday. So we're talking about the difference between original Medicare and a Medicare Supplement and a Medicare Advantage Plan. And Toni tries to point you in the direction that will have the best opportunity for you to get the best medical care that you might need. You may be someone who's having medical issues, or you may be someone who maybe never had any medical issues, but you don't know what's going to happen tomorrow, right, Toni?
That's right. And I've seen it change for a lot of people very fast. So, it just takes a visit to the doctor that can change literally everything. And there is no best and there is no free as far as Medicare is concerned. Medicare doesn't like us to say something is best. What's best for me may not be best for you. You've got to find which plan meets your needs. And what you should do is talk to your doctor and find out what they think is your right way to go. That's what's important. With the Medicare Supplement, with original Medicare, or original Medicare with the Medicare Supplement, it's the same thing. You're in control of your health care. Your doctor is in control of your health care. With the Medicare Advantage Plan, they are fine. They're great plans. But are you really buying your health care because you want to go to the gym? Or you want to get a dental plan or a vision plan, or you want the discount at your local pharmacy? What is important to you? What best meets your needs? That's where you need to go. And they can always call us at 832-519-8664, or they can email us at info@ToniSays, ToniSays.com. That's the easiest thing to do.
Well, the Medicare Advantage plans certainly are popular because of what you said, Toni. There's gym, there's dental, there is vision, and there are other things. But it looks like when working with original Medicare, the supplements give you a lot of control.
They give you and your doctor more control. And you can go anywhere nationwide. I'm in Houston. If I need to go to the hospital in UCLA, or I got to go to Tulane, or I have to go to Mayo Clinic, I just pick up the phone and make an appointment.
You have the flexibility and you have the option. So this is Medicare Moments with Toni King. Toni Says, ToniSays.com. If you have a question, don't hesitate to give a call, 832-519-8664. That's 832-519-8664. And Toni or her team can get back to you and answer your question, leave a detailed question. I mean, you can wake up in the middle of the night and call her. You won't have an answer right then. When the staff gets in, then they'll give you a call back. Right, Toni?
That's right. We did the best we can.
So thanks for listening to this edition of Medicare Moments. We hope we helped answer some of your questions. And it's all about making your Medicare experience the very best Medicare experience, because that means you're getting the very best healthcare for your particular health needs. And that's because of Toni's expertise. Toni?
Thank you. I appreciate it. Talk to you later, Jim.
Attention seniors. Are you looking for a community that offers incredible benefits and stands up for your values? Look no further than AMAC. With an AMAC membership, you'll enjoy exclusive discounts on insurance, travel, dining, and shopping. Stay informed with 6 issues a year of our award-winning AMAC magazine, delivering trusted news and valuable insights. But that's not all. AMAC is committed to defending America's future by directly bringing the voices of our more than 2 million members to our elected officials. Join a community that cares about your needs and your values. For a limited time, we're offering a 1-year membership for only $1. Yes, just $1 for a year of incredible benefits and advocacy. Don't wait. Take advantage of this special offer and join AMAC today. Visit amac.us/join now. That's amac.us/join now.